the last thing I believe you did were these two up here, okay? And you were going to do down here, but you decided I lost too much bone there. However, as long as you're recording, I didn't realize it. I got to tell you something. I'm very happy that I waited all this time to get my teeth done, because I found the best doctor. I really did.
That's very kind of you.
I really did.
We did some immediate extractions and placed the implants in as well.
That's right.
And if I recall, you didn't even need to take more than one pain pill at all.
That's right. And I only took that because I was afraid I was going to get pain.
Right. And then we have a dentist in the family, is that right?
Yes. My son-in-law is a oral surgeon.
Right, and I had spoken to him and let him know, and we let him know.
When we left here, he said to me, he went like this, and he says, "You're in good hands."
Well, from the smile, in terms of Dr. Goldring, restored everything. Aesthetically, it looks great, and in terms of if you had to give some insight or educate people in the future, I mean, do they feel like natural teeth? Are you able to do whatever you want with the implants?
Oh, absolutely. Absolutely, no question about that. I only didn't do it years ago and ended up with the kind of mouth that I have today. It's because back in those years, I was really afraid of transplants. I was willing to do anything in the way of...
even having someone in the family who was an oral surgeon.
Well, at that time, I didn't even have anybody.
Oh.
I mean, this is how far back in time I'm talking about. And I was really afraid. I had heard such horror stories.
Well, things like, technology and techniques and experience and education changes over time, whether it's medicine or just implants like this. So
right,
to me, because I do it on a daily basis, I'm desensitized to a certain degree because I see most of my patients, they don't have discomfort.
I have to tell you, first of all, I think discomfort has a lot to do with the individual.
Right.
Okay? How they accept certain things, all right? There's some people who can tolerate pain better than others. But although I do tolerate pain, I really didn't have any, so there was nothing to tolerate.
And in terms of your choices or your options, you would never have gone with a denture.
No.
Okay, well,
not at this stage. I have to tell you that, 20 plus years ago, no more than 20 years, what I'm talking about, before I had my son-in-law, quite a while ago, 25 to 30 years ago, let's say, with the stories that I had heard, back then I would have. But now, absolutely none.
So how would you rate the experience here at the office?
Oh, great. Really, really.
Okay, and you definitely would do it again?
No question.
In terms of what you know? Because I've worked on you a couple times, and we've
several times you've worked on me.
And it's never been any hesitation in terms of the course of care.
No, and I'm a nervous person. The only reason I would take a tranquilizer the night before is because I know me.
Right. We did give you one, a little happy pill, I call it. It's a little Valium.
Right. And it was nothing, and it was terrific, and it was wonderful. It was, as far as experiences like this go,
and dentistry,
it was the best.
Well,
that's all I can say, really.
Yeah, well.
Nobody loves to go to the dentist, and nobody really wants to.
But this worked out. This worked out wonderful for you.
Oh, it was great.
Well, thank you.
It really was.
Thanks for the kind words. I appreciate it.
Yeah.
We'll look forward to seeing you for your hygiene visits.
Okay.
Such a pretty smile. You take care. Thank you.
All right. Thank you. You're welcome.